Welcome back to AAKP's National Kidney Patient Consumer Policy Roundtable, the critical need to overcome government determinants of health. For those just joining us, I'm Ed Hickey, a kidney patient and president of AAKP. I also chair AAKP's Veterans Health Initiative. The final discussion topic is entitled Transplant Diagnostic Testing, the 2023 HHS CMS policy change that disrupted transplant professionals and Medicare transplant patients and contradicted stated presidential commitments. I would like to ask AAKP Chair of Policy and Global Affairs, Paul Conway, a 27-year transplant recipient, to remain with us as I welcome Dr. Stephen Potter, an esteemed transplant surgeon at MedStar Georgetown Transplant Institute, joining us live and remote. Dr. Potter is a professor of surgery and urology at Georgetown University School of Medicine, the chair of the Legislative and Regulatory Committee for the American Society of Transplant Surgeons, and the chair of the Centers for Medicare and Medicaid Innovations Living Donor Demonstration Project through ASTS. He is also a 2024 AAKP Medal of Excellence Award recipient. This is a critical topic for transplant patients and transplant professionals. Please check your agenda links for additional information on this issue. On February 9th, AAKP issued an official statement in an AAKP Closer Look report highlighting a new double standard and unequal access for Medicare kidney transplant recipients who rely on molecular blood tests for organ health surveillance and the identification of early organ rejection. AAKP and a broad base of community leaders has spent considerable time over the past year raising the issue to congressional leaders, executive branch officials at HHS and CMS, and the media. As you will hear in this discussion, CMS and one of their Medicare contractors made a horrible decision that has had a devastating impact on transplant patients. To be clear, this decision must be reversed by HHS and CMS before any further harm is done to transplant patients. Dr. Potter, let me go to you directly to get us started. I have several questions for you. Can you tell us exactly what molecular blood tests are and why, as an innovation, they are so relevant to kidney transplant recipients?
Ed, thank you so much for having me. It's an honor to be here, and it's an honor to see my old friend Paul Conway. These tests are absolutely critical for kidney recipients, and they really are a complete paradigm shifter from where we've been in terms of managing kidney patients for the prior 3 decades or so. Like prior to the development of molecular testing to surveil for organ transplant health, we were stuck using really old legacy tools like serum creatinine, looking for protein in the urine, and then ultimately doing invasive and potentially dangerous biopsies if we wanted to know what was going on with the transplanted organs. But with these tests, we have an early warning radar of sorts that gives us a much earlier window into immune activation and organ injury, so they can make the diagnosis of rejection in kidney recipients up to 3 months earlier than any other test. And they do it in a non-invasive fashion. So with this groundbreaking technology available, this really became rapidly a standard of care that the majority of transplant centers in the country were utilizing on a regular basis to monitor their patients, and something I would hasten to say patients were very happy with and quickly adopted, because you don't have to be a kidney recipient for very long to realize that biopsies are not a thing that you look forward to. There's something to be avoided unless absolutely necessary. And these tests not only give us an earlier diagnosis of rejection, but they also allow us to avoid many otherwise unnecessary biopsies.
Thank you. And following up on that, Dr. Potter, can you summarize exactly what CMS and their contractor did in 2023 that disrupted the patient access to these tests, and how many of these tests were impacted?
Well, from 2017 on, there was broad coverage of these tests for patients. And during that time, there was mounting evidence in the peer-reviewed literature. These tests were robustly analytically validated and clinically validated, and their utility was quite clear for these, challenging and complex patients in need. And they were adopted, as I said, as a standard of care. In March of 2023, that's when things changed because MolDX, which is a sort of a component of the MAC, the Palmetto Medicare Advisory Contractor, issued a billing article curtailing the access for patients to these important tests. And that is puzzling because there is an overwhelming groundswell of evidence in the literature supporting these tests and their utility. And the billing article issuance isn't really the correct process that you would use to change coverage. So that was concerning in and of itself. It didn't allow for any public comment. And in fact, prior to issuing the billing article in March of 2023, MolDX and Palmetto had convened 2 expert physician panels of transplant professionals to try to garner their insight into how useful are these tests, where should they be used, how often should they be used. And the panel input was uniform that these tests were vitally important for patients and of increasing importance in the clinical arena. And yet that medical advice from the very panelists that were convened by the contractor was completely ignored when the billing article was issued.
So there were 28,000 fewer tests since the new billing order was issued?
Well, it's actually more dire than that, Ed. So from the 9 months ending when the billing article was issued, compared to the 9 months immediately following the issuance of the billing article, there were 28,100 fewer tests ordered.
Okay.
That's just over 9 months. And that's only in kidney recipients. And that doesn't capture any of the patients that were transplanted after the billing article was issued, because those patients presumably also would have been receiving tests and were much less likely to be tested. So 28,100 is the 9-month decrease in test volume, but that's a very conservative estimate because of what I just mentioned.
I see.
If you annualize that to 12 months, that's about 37,000 fewer tests in thousands of kidney recipients in need.
Wow. And so based on your practical experience as a transplant surgeon and among your fellow surgeons and patients across the nation, can you tell us what the practical impact has been from the CMS decision?
Yeah, I mean, I think the massive decrease in test volume is sort of a powerful rebuttal of any argument that the billing article didn't provide a substantive change in coverage and didn't have a massive impact on the transplant community. I mean, that's a dramatic number, and that's a lot of lives at risk. And so what happened when the billing article was issued, it really had a chilling effect on transplant centers around the country because, they want to be in compliance. Everybody's trying to do the right thing, and they also want to take great care of patients, but there was a great deal of confusion that was introduced by the billing article. And in particular, obtaining non-invasive molecular diagnostic testing in these patients in need with the need for invasive surveillance tissue biopsy is a giant step backwards and was very confusing for transplant centers. And you have to remember, transplant centers, the large majority of them don't do surveillance biopsies. So to say that you can only get the test if you were going to get a surveillance biopsy sort of is nonsensical when about only 18% of transplant centers even do surveillance biopsies. So there was an awful lot of confusion there, and heartbreakingly, a lot of upset patients who were justifiably concerned and afraid because they'd come to rely on these tests over the preceding 4 years or so.
So thank you, Dr. Potter. Paul, I'd like to move over to you. And can you describe exactly what a disconnect the CMS decision is in terms of the national policy on transplantation and the commitments that President Biden has made to the kidney community?
Sure, Ed, and thank you very much. This is probably one of the most pronounced examples of government determinants of health that we've seen. at AAKP in decades. And let me put it in full context. So the national bipartisan consensus policy in the United States, as adopted and held by multiple presidents and Congresses, has been that transplant is the preferred therapy over dialysis for those who are suffering from kidney failure. So in 2013, President Obama worked with Congress to achieve passage, and he signed into law the HOPE Act, which for the first time made available HIV positive organs for HIV positive patients. In 2016, President Obama and then Vice President Biden had a White House summit on organ transplantation. And in those discussions and in the breakout meetings that occurred at that White House summit, what was very clear is there was a national commitment to reduce the number of people on the waiting list and the number of people who die waiting for a kidney. But key to that was not just increasing living organ donation, but it was making certain that those people who are already planted keep their organs as long as possible. That White House summit preceded these tests from coming into the marketplace. And then in 2019, we had the executive order under President Trump that prioritized transplant over dialysis and status quo care. And then just last September, you had President Biden signing one of the greatest overhauls of the organ procurement system in the United States. So very clearly, organ donation, increased transplantation is the national policy, and making certain that people that have their organs keep them. The most puzzling thing is the direct contradiction that CMS and HHS have engaged in from specific presidential executive orders from President Biden and monthly statements that the president has made around Kidney Month and Organ Donation Month. There's one particular executive order, 13985, that the president signed on his first day in office when he came in after inauguration. And basically, that's a charge to federal agencies to examine their programs and their processes to determine what barriers their own actions may be creating in terms of access to care for historically marginalized or underserved communities. So you think about this and what's happening in this decision by a CMS contractor, which has been defended in a press release by the CMS administrator, and think about the Medicare population and the folks who are trying to get a transplant and keep their transplant. We can't think of a larger barrier that's been created by a federal agency getting between transplant surgeons and patients. And so it's very, very clear, and it's a barrier that's been noticed by the Congress to a very large degree. Let's put it like that.
So how has the media covered this, and what can the audience do to raise greater public awareness about the issue?
There are a lot of issues that happen in Washington, as those who live here and work here and around the country can see. A lot of it sometimes is nonsense, a lot of it is serious. But you have to work really, really hard to get 3 Wall Street Journal editorials in the span of about 4 or 5 weeks denouncing your federal agency's action. That happened. That was Wall Street Journal editorial coverage of the CMS decision. USA Today, specialized publications have all denounced this as contrary to national policy that's been upheld by multiple presidents and Congresses. And a lot of media inquiries are happening now as a result of a broad-based community response to this that includes patients, organ donors, organ donor families, for those who lose a loved one. They're just as invested in this as well. And so you're seeing as a surge on social media and in the mainstream press about this issue. And you're also seeing more press generated by congressional action. Right now, there is a Congressional Black Caucus letter to the CMS administrator demanding answers on this, how this happened. There's a bipartisan letter dating back to August of 2023, signed by leaders in the Congressional Kidney Caucus. Representative Ashu from California has been a leader on this issue. And each of those letters is also generating a response because of the lack of CMS response. We only see this issue accelerating and national media picking it up, in part because of the actions that patients and patient advocates are doing all over the country. Just to give some context to what Dr. Potter said, The media markets in places like Michigan, South Carolina, Pennsylvania, Ohio, Arizona, and Nevada, and Wisconsin are going to pick up on this. And I'll tell you why. In Michigan, the testing has dropped 50%. In South Carolina, it's down 46%. In Pennsylvania, it's down 36%. Ohio, 26%. Arizona, 68%. Wisconsin, 55%. And so when you look at these issues and you think about the people that are impacted and where they live across the country, and when patients raise their voice, it will capture the attention of media. We're quite certain of that.
Thank you. Wow, thank you. And thank you, Dr. Potter. This is truly a tone-deaf and unjust decision. And CMS and HHS owe congressional leaders a full and thorough response for their actions. They have an obligation to kidney patients and the American people to end the kidney care disruption that they have caused. Again, AAKP believes the 2023 action by CMS and its contractor must be reversed and a full coverage and access restored to previous levels. If CMS and HHS are incapable of addressing this issue, AAKP believes the White House should certainly intervene, especially given the stated commitments the President has made to the kidney community. Again, thank you everyone for watching and being engaged in this roundtable. You can access more information on the issue by clicking on Read and Learn links located within this discussion topic on our digital agenda or provided QR codes. We'll also keep you informed through our direct communication, social media, and our Action Center on efforts AAKP is taking on this issue and how you can become involved. With that, I'd like to again thank our audience here in the room and online, as well as our fantastic panelists. I would also like again to recognize our generous sponsors, including CSL, Vifor, Bayer Pharmaceuticals, and Mallinckrodt Pharmaceuticals. The government determinants of health discussed today are serious issues. Together, they impact patients and families, communities, including historically underserved communities, taxpayers, and our society. As a fully independent organization, AAKP is committed to raising these issues to the public, the media, and to elected and appointed leaders throughout 2024. We have no fear and no hesitation to call things as we see them from a pure perspective AAKP holds as patient advocates. That includes instances where government itself, whether they are well-meaning, misinformed, or just plain wrong, poses a threat to kidney patients and kidney medicine. We will also continue to encourage all patients with kidney disease, professionals who work in the field, and all people of goodwill who want to help to address these issues to register to vote as kidney voters and to make their voices heard to their elected and appointed officials. 2024 will be an important year for both our nation and for the future of kidney care. And we encourage everyone to have their voice and their vote count within our democratic process, especially on the kidney issues that impact over 37 million fellow Americans. All discussion panels have been recorded and will be available on demand, post-event, and widely shared across AAKP's multiple platforms. Your elected leaders, as well as officials at CMS and FDA, will not be able to ignore our unified voice on these matters. Now is the time to challenge the status quo, and AAKP has the tools to allow you to do so respectfully but forcefully. As always, if you are not currently a member of AAKP, please join us today at aakp.org #join. Also, please follow us at Facebook, Kidney Patient, and X at Kidney Patients, as well as on Instagram. And finally, please review the digital agenda for today because it includes multiple links that provide additional information and specific actions you can use to take action and make your voices heard on these issues. Take care and be well.